Our next presenter is Preeti. She is a research scholar at IIPS, Mumbai. Preeti, you here?
Yes, sir. Yes, sir.
Yeah, please go ahead and take over.
Hello, everyone. My name is Preeti, and I am one of the research scholars from International Institute for Population Studies. My research topic is rural-urban disparities in alcohol consumption and its association with the multimorbidity among older adults in India, evidence from LASI. Let's move to introduction. Harmful alcohol use is a significant public health problem globally. Excessive alcohol use has a direct impact on health-related sustainable development goal number 3 through the infectious disease and non-communicable disease and mental health. In 2016, approximately 49% of alcohol attributable disability adjust life years were due to NCD and mental health conditions. In India, the prevalence of alcohol consumption among older adults dealing in multiple health conditions varies between rural and urban area due to difference in social cultural factor. The distinct pattern observed underscore the necessity of tailored research and intervention to address the morbid older patient in diverse geographic context. In data and methods, data sources, LASI, Longitudinal Ageing Study in India, 2017-18, day 1, and respondent are older adults aged 45 and above, diagnosed who are 2 or more chronic conditions, multimorbidity condition, and outcome variable are alcohol consumption among older adults having multimorbidity, or group variable are residents rural versus urban. And statistical analysis, descriptive statistics, logistic regression estimate, and Ferry decomposition method were used to accomplish the study's objective. For the study, the data analysis were done using Stata version 17. For result and finding, alcohol consumption prevalence is 27.29 among multi-morbid older adults in urban area. And 15.5 in rural India. Alcohol consumption is more common among older adults with multiple chronic condition in urban setting compared to rural one. So for the odd ratio explaining the multimorbidity, alcohol consumption among multimorbidity older adults in India, the alcohol consumption and multimorbidity are strongly linked with the alcohol user having significantly higher odds of being multimorbidity. And a female are 1.33 times likely than males to have multimorbidity. And individual who consume alcohol 4.703 times more likely to be multimorbid compared to those who do not consume alcohol. This association is highly significant. And 61 to 69 age group are 1.77 times more likely to be morbidity. Those who are not in urban, those who are in urban, not in urban, are 1.19 more likely to have multimorbidity compared to those who are in urban union. People living in urban area are 1.71 fold times more likely to have more multimorbidity compared to rural area. And if we see the caste wise, if we see the religion, Muslims are 1.54 times have multimorbidity. If you see the wealth index, the richest group is 3.05 times more likely to have multimorbidity. And those who are not working, 2.085 times more likely to have multimorbidity compared to who are working. And this is the estimate of rural-urban decomposition analysis for the contribution of explanatory variable of alcohol consumption among older adults. So this shows the percent contribution in the factor which is most contribute and in the rural-urban difference. So most important, most effectively, the current working or the working status is 94.58% contribution, and education 20.22% percent contribution. Means education, caste, employment are the major drivers of rural-urban gap in alcohol consumption. Rural are likely having lower education level, different caste distribution, and higher working rates among older adults. So this shows that the rural people are working. So that's why this currently working factor is higher in that rural-urban decomposition analysis of percent contribution. So move to discussion. The prevalence of alcohol consumption among older adults, multimorbidity was 11.79 higher in urban area, and 27.29 than the rural area. Older adults with multimorbidity belonging to the scheduled caste group were 40% more likely to consume alcohol. Older age, female gender, urban residents, or higher level of certain caste, religions, wealthier individuals are those who not working more likely to experience multimorbidity. Or additionally, fairly decomposition analysis reveals that the education, caste status, and employment status were the factor contributing to the differences in alcohol consumption prevalence among older adults with the multimorbidity between rural and urban areas. So conclusion, we found the significant rural-urban difference in the consumption among older Indian with multimorbidity, and the finding underscore the need of target address the challenge faced by the older patient in the rural area and urban area, including the lack of social capital, limited resource that enable access to healthcare services. Policymakers and healthcare professional collaboratively design the implement effective strategies, limit the alcohol consumption, and overall well-being of urban older adults, particularly those with multiple comorbidities. Thank you.
Thank you, Preeti. Thank you for excellent presentation.